Your lab markers are just one piece of the entire puzzle. This is what I want you to take away from today's session. My name is Anindita. I am a functional medicine certified health coach. I am also an AFMC practitioner from the School of Applied Functional Medicine. I work with women with autoimmune conditions and I help them to address the root causes using a functional medicine approach, increase the energy levels and start getting better soon. And in today's session, I'm covering the topic of getting, normal or abnormal lab markers. Obviously, if you're listening to this live session, you would have, something to do with an autoimmune diagnosis. Maybe you're waiting for a diagnosis. Maybe you already have a diagnosis. Or maybe you just have an abnormal marker and you don't know where you are right now. That's actually an extremely common place to be because especially in the case of a complex multifactorial disease like autoimmune disease where your immune system is involved, it takes a very, very long time usually to get an accurate diagnosis and to get started on the treatment. And in the midst of all of this, what typically happens is that most people keep getting sicker and sicker, or maybe their symptoms keep increasing in intensity and variety. And I want to help you with that. I want to ensure that you don't have to wait till you reach that stage. I want you to know that you have options in front of you. And because disease for most chronic conditions begins in the gut, and it is by understanding the disease dynamics, it is by taking a root cause approach, you can start laying the foundations of good health with or without an exact diagnosis of your condition. So whether you have a sort of lab reports with you, but you're not very clear on what diagnosis you have, or maybe you already have a disease diagnosis and you know what disease you have and you're just waiting to get started on the treatment, it doesn't really matter, right? These are the basic steps that you need to take. Once you understand what is at play, you will realize why this is important. And that's what I'm going to delve a bit deeper into today. Of course, I would like to start out with the fact that lab markers are important, right? They are important because they give us data. They let us know what's going on. They sort of give us a sense of direction. Obviously, if you're dealing with any chronic health issues, we need the right treatment, we need medication. So in that sense, your lab reports will tell your doctors what needs to be done, what treatment you should be following. So in that sense, of course, it is very important. But what I'm explaining or what I'm sharing with you here is that it is not the entire picture. It is just one piece of that. So what typically happens is that as we keep waiting, to hear back, as we keep, waiting to know, maybe we already know we have one particular diagnosis, but we are not really sure of, what else is at play. And that can take from months to years to decades in some cases. And in the midst of all this, what happens is that, of course, our symptoms keep worsening. And by the time we get an actual diagnosis and we start following a line of treatment, a lot of damage has already been done. And this is something that I see is very common because of the approach that conventional medicine takes. And once again, it is not one or the other. It is not that I am saying that you should not figure out what's really going on, or you should not be looking at getting a diagnosis or following a particular line of treatment, because it is important in most cases to start medications at least for the short to medium term, so that so I'm talking about, Amreen, would you ask? Because I'm talking about why lab markers are important and, in autoimmune disease, but why they are not the entire piece of the puzzle. That's what I'm talking about. So I'm talking about lab markers, I'm talking about lab reports, I'm talking about disease diagnosis. This is a very, very common issue that I find in people with complex chronic health issues, specifically autoimmune conditions. I hope that clarifies your question. Thank you for asking that. And what I'm sharing with you right now is the fact that while you're waiting for a diagnosis, while you're waiting for your doctors to prescribe a line of treatment, there are many things that you can do to start creating the foundations of long-term health. That's what I'm sort of sharing with you today, because total immunoglobulins, knowing what kind of numbers you have, say anti-nuclear antibodies, ANA, which is a predictive marker of future autoimmunity. About 95% of autoimmune disease development takes place in 10 years. All this is important, and it acts as a wake-up call, but it should not basically it should not allow you to feel that you have nothing that you can do while you're waiting for these kind of answers. Because one thing that I find most people waiting for, especially in the case when if they've already got a positive ANA level, doctors have gotten back to them that you have some kind of autoimmunity, but we don't know which one it is that you have. And then you start obviously following up with disease-specific antibodies like TPO-TG for thyroid, maybe anti-TSHR for Graves, and some of them. But none of these are fully sensitive tests. That means that you may not really show up in your markers. And in the meantime, while you're waiting for those answers, while you're waiting to know what's really going on, things just keep getting worse. Because one thing that I want to sort of reiterate, and I talk about it in my blogs at anumitaruta.com, you can check that out, is that disease dynamics are important to understand. Because one thing that we know now is that if you have shown if you have shown to be positive for any of these antibodies, for any of these markers, then you are most likely on the autoimmune spectrum, which means that you're moving either towards health or towards disease. But your immune system is certainly reacting to something. It is responding. It is creating antibodies every single day. So whether you feel it or not, whether you have symptoms or not, it is irrespective of that, you're already on the autoimmune spectrum. And this typically happens for various reasons. And in fact, this is what I work on with my clients in my coaching program. I'm opening this for enrollment. In fact, next week, I have limited number of seats available. So if you're a woman dealing with autoimmune conditions and you're looking to figure out what's going on, get answers, and more importantly, start feeling better, more energetic, less pain using a root cause approach, then make sure that you click on the link in the bio for Instagram and schedule a free 45 minutes clarity call, or the link in the post for Facebook. So this is where we sort of figure out if we're a right fit, how we could sort of create a plan for you. So that's what you can do. But again, coming back to the disease dynamics, typically as far as autoimmunity is concerned, there is some gut dysfunction going on. There is some element of gut dysbiosis. That means that there is an imbalance in healthy microbes to pathogenic ones. There is some element of enhanced intestinal permeability, aka leaky gut. And of course, there are many functional testing which can be done, which can confirm many of these things, but it's not necessary, simply because we know the research behind all of this. There may be things like a body getting exposed to endotoxins like inflammatory liposaccharides. These are toxins that are produced in the body, typically from the cell walls of dead bacteria, which are sort of getting into your bloodstream, which is causing your immune system to respond. So all of these go hand in hand with many of the autoimmune diseases. So food sensitivities, of course, sensitivity to gluten is a big one. So many of these things which are ongoing in any kind of autoimmunity is something that you have control over, in the sense, especially where the food is concerned, where your lifestyle choices are concerned. So you can start taking action, right? You don't, again, that's the reason I sort of saying again and again that it's not about getting a particular diagnosis or lab markers all lined up perfectly for you to get started on working on some of these aspects of your health, right? Because you can start creating, laying the foundations of good health even while you're trying to figure out what's going on. And in many cases, what happens, and I see this with my clients, we see this in the field of functional medicine, is that people start getting better. They start feeling better. And these are, mind you, different kinds of complex chronic health issues, right? Because your body knows what to do if you just provide the support that it needs from you. So what I recommend to my clients, and what I would recommend in, if you are sort of in this in between stage, is to start treating your body as a friend, right? Paying attention to the kind of choices that you're making, committing to making healthier choices on a daily basis. So that means that you don't wait for symptoms to develop. Maybe you already have symptoms. You don't wait for more and more symptoms to develop. Maybe you don't have any symptoms at all, but you have some maybe abnormal NA markers. So you're not waiting for anything else to develop, to happen, before you start taking these proactive measures. And it starts with as simple things as focusing on real nutrient dense foods, maybe, right? So having a wide variety of fruits and vegetables, colors of the rainbow, and I've talked about the phytonutrients in plants and plants which help keep our immune system healthy and balanced earlier. So you start doing all of this from today. You don't have to wait for anything or anyone. Real nutrient, of course, food is where we start. Food is medicine. The other thing is no gluten, and maybe in some cases no dairy, and maybe soy, corn and eggs. Gluten is a big issue with anyone who has autoimmunity. So gluten is the first thing that we look at taking out. It helps to start removing the triggers that are finding the fires of inflammation which is going on due to this continuous immune response. Of course, commitment to healthy lifestyle choices, like going to bed on time, making sure that you are getting at least 7 to 8 hours of sleep, putting maybe in place some bedtime rituals, bedtime routine, taking adequate rest, not because you're forced to, but because it's important for you. So many of these lifestyle choices, they build up over a period of time. You may not see the results immediately, but you will start seeing the improvement soon. And these kind of commitments are important for at least a year or so. It takes time for your body to get back into balance, for your gut to sort of start healing and repairing the gut lining. But you start seeing the improvements much earlier, much before, right? And in my coaching program, we track this every 2 weeks, every fortnight in the coaching sessions, with the help of medical symptoms questionnaires, with the help of other, during the coaching sessions, we also lab markers. So there are various ways of obviously tracking your progress. Medications or treatments are obviously usually important in the short run. But many of these can be sort of, either the dosage can be lowered. Many people do go off some of the medications. My own daughter is an example of that. She was on immunosuppressive medications for 5 years, and she was able to go off them as we repaired her gut lining, worked on her gut health. So at the end of the day, it is a step-by-step approach. It is a step-by-step approach simply because there are so many things that need to be tackled that it can sort of become very overwhelming, and you start, you don't really end up doing much about it at all. So it is a step-by-step approach. You start taking these baby steps by focusing on food, by focusing on creating a healing environment, by focusing on getting enough rest and relaxation. These are the basic things that you can start working on right from day one. Whether you have a diagnosis, whether you don't have a diagnosis, whether maybe a particular marker has come up as abnormal, it doesn't really matter. What matters is that you get started, you start treating your body not as an adversary, but rather as a friend. That's a big part of my coaching program, because we are typically conditioned to believe that our body has gone rogue, our immune system has gone rogue. It is creating antibodies towards our own tissues for no rhyme or reason. So there are many things that we're conditioned to believe, and in effect that we're trying to fight ourselves, because your body is a part of you. You are one whole person. The way that root cause approach is most effective is when you start appreciating what your body is doing for you, making it your friend, treating it with compassion, using a mind body approach. And this is a big part of my coaching program, which is why self-care is a big part of my coaching program. Self-compassion, gratitude, these are all tools that we use in the coaching program. So if you like any of these, whatever I said here, whether you are dealing with an autoimmune condition already, or if you are looking or waiting for a diagnosis, there are so many things that you can start doing to create long-term health, right? And this again does not depend on any external factors per se, but it depends on your level of commitment, your conviction, in your body's healing abilities. And that's where you focus on. That's how you take your power back. That's how you become your own advocate, right? And I invite you to schedule a 45 minutes clarity call for my coaching program, Healing from Within, which is for women with autoimmune conditions who are looking to get their lives back on track, increase their energy levels, and lay the foundations of long-term health using a root cause approach. It opens for enrollment next week, so make sure that you schedule the call today. The link is in the bio for Instagram, and it's in the Facebook post. Just you can click on the link and schedule a call right now. If there are any questions that you have, make sure that you drop in the comments. I'll make sure to come back and answer them. Thank you.